Different mental health conditions have been described in a lot of my previous videos. There's also this aspect of these conditions that they change with time. At one point, a condition may not exist. Then clinicians and researchers behind the diagnostic criteria of conditions may decide and reach consensus that this condition should exist, although it didn't previously. Alternatively, a condition may exist at some point, and then later on, it doesn't exist anymore because clinicians and researchers who are involved with diagnostic criteria may decide that it no longer needs to exist. And another aspect of this is a condition may change and evolve with time, such that there are different criteria or different names that accompany this specific mental health condition. An example of a condition that does not currently exist but may at some point is caffeine use disorder. As of right now, it doesn't currently exist. There's no specific diagnosis for a caffeine use disorder, but I'll discuss this in a future video. The odds are that a caffeine use disorder diagnosis may exist at some point in the future. And like I said, there are also conditions that did exist at one point but no longer exist currently. An example of this is sexual orientation disturbance. This is a mental health condition that did exist at one point but no longer currently exists. Then there are examples of conditions that have changed and evolved with time. So for example, there's this current diagnosis of alcohol use disorder. At one point, recently, it was actually called alcohol abuse or alcohol dependence as two separate diagnoses. But now there is a merged diagnosis called alcohol use disorder that ranges in severity from mild, moderate to severe. So when I'm describing these conditions, something that you may need to consider is what conditions exist today but may not exist tomorrow? What conditions don't exist today but may exist tomorrow? Also, how will some of these conditions change and evolve with time, whether it's the change of their specific name or whether it's the symptoms that are described with these conditions being reduced or changed or adapted. So with those questions in mind, tell me what you think. What are some conditions that you think will exist today but don't tomorrow, and vice versa? And then also, what are some conditions that you think will be adapted or change with time? Thank you so much for watching, and I can't wait to read your feedback. Thank you.